Good morning everyone. I am Dr. Pratap Singhasivanon from the Simeo TropMed Network and the Faculty of Tropical Medicine, Mahidol University. Today I will be discussing with you on the infectious diseases aspect on the perspective. As you know that One Health is extremely important concept. So everyone must know and understand it fully in relation to infectious diseases. And if you have the foundation of epidemiologic perspective or epidemiologic background on how the disease spread and how it transmits and what are the important aspects that we understand on emerging and re-emerging infections, that would also put on One Health perspective relationship. So as you know that our world has rapidly changing, it become more complex world because of many factors that we will see today that it affect our world. So if you look back 100 years, if you look at back 100 years, our world is, if you're looking from the space, is very clear. Okay, it's clean, clear, and when compared to if you're going to look ahead 100 years from now, you will see that our world will be full of something that maybe we call the space garbage. Will be around the world. If looking from far away space, our world will be totally changed from 100 years early. So you see that within the span of 100 years, so many things would happen, and therefore now we are living in the world that we call VUCA world, the world that is have very high volatility. We have uncertainty and also have extremely complexity and ambiguity. So this is going to be the world today, and is going to be world of the future. So it's not going to be something that when we say our world that is quite stable, is quite predictable, or it is some outcome that you expect to be simple and linear, and is something that result is very clear, and then you can look at something is straightforward. It's not going to be anymore. So these are some of the things that we have to prepare for in the future, especially for infectious disease. So therefore once our world become more complex, so it affects when there is a aspect of change rapidly, whether it is environmental, climate, population structure and others. It would change the global health, public health scenario. So with the micropathogens spreading from jumping species from animals to human, and also spreading from human to animals also, and also from man to man, and then it would be our public health landscape would not be the same anymore. So if you look at our world today, there are so many things that is being changing, okay, and then this is we call disruptions. It means that if once it is disrupted, it will not come back to the original state anymore. So therefore you can see here some of the factors that may be associated with the changing of the global public health landscape. As you can see, the first factor is globalization, which has been started a few decades ago, and you see that our world become interconnected. Everything is being connected, whether it is economy, whether social structure, and whether also the health. So therefore because of people travels around the world, more than 1.2 billion people will be travel around the world each year, and after that it will be more and more. So therefore this will be the route for infectious disease to be spread out very rapidly if the pathogen is highly infectious. And also we see that that is a demographic transition. People are age more and more, so you will see that people more than 65 years old will be comprising more and more in the population's structure, and also that is an increased urbanization. Population density in the urban area will be used to urban. Have also environmental degradation that also lead into climate, and climate change would also lead to natural disease. Okay, because of the people inequity, so you have poverty resulting from conflicts and war, as you can see today. Okay, that we have a lot of conflicts in many areas around the world, and also we have also once you have widespread infectious disease occurring like pandemics like COVID-19 today, we will see that we will have strains on our public health system. Our health system is overloaded, and then it also affected other diseases. We have with war, with conflict, we have food and energy crisis, and then on top of that we also have many emerging diseases and threat of the future pandemics due to increase in the human-animal contact or interface. We have also demand of the wildlife products that also lead into the spillover of infections from animal to human. That would also lead to safety and security once there is a social disruptions of the food and energy crisis. That would also lead to income disparity and accessibility inequity to health. That also due to economic parameter like inflation, that would also lead into social disruptions, and as you know, violence, protests, and also lead into the mental health issues. And this is also due to another aspect is the knowledge and technology explosion that lead into mis and disinformations. So therefore, these are some of the things that we have to understand, because it also affect our public health landscape. And as you know that because of the pathogens, it spread everywhere in the condition of the pandemic. Environmental issues already. The crossover from one species to another, global warming, and also antimicrobial resistance. So these are some of the factors that I have already mentioned. In fact, I'm listing into words for you to see that human susceptibility to infection also increased because of the we are exposing ourselves to the new pathogens which we never have a vaccine or natural infections before. Okay, and also with the issue of pandemic, that is a breakdown of public health measures, and also political will that is not there in order to upscale our public health system, and the poverty and social inequity. So these are some of the things that we see today, and as you know that with the COVID pandemic, it has been tested us to the limit, because it is the issues that we have to understand is not the conventional issues anymore. So today I would like to introduce you, which many of you have already learned and know about this in your earlier educations before you are here today. So I would like to stress on the infectious disease, which as you know that it is the biological agent, can be specific infections, infectious agent, or its toxic products, okay, that can be directly transmitted or indirectly transmitted from man to man, from animal to man, animal to animal. Okay, it can be through the routes, several routes of food, water, air, or contacts or droplets. Okay, so these are some of the aspects that we'll be discussing today. As you know that the microbial pathogens, we can classify it in many ways. As you know that it can be virus, bacteria, parasite, rickettsial, or fungal infections, or parasite can be several protozoa infections or helminthic infections. So these are some of the new aspects that we have to consider because of the changing world. And as you know that to date we have 1,415 microbial pathogens. By the time I'm speaking today, it will be more than today, infectious, that are infectious to man. So we are living in the environment that are full of microbial pathogens, and these are infectious. Some can lead into mild, asymptomatic, or mild, or some are moderate symptoms to very severe and to death. So there are different spectrum of the disease of the microbial pathogens. And as you know that now we have terms like newly emerging infections. It just means that some of the infections that have not been reported in the past 2 decades, okay, and then it has been reported for the first time, and some of the diseases that is already present in the past disappear and then come back and then spread into the new locations or new geographical locations, or it can be in the that has been using and become resistant. So this can be re-emerging or emerging, but now we are using the emerging as a term for the newly appeared infections, or some of the infections that disappeared and come back, or some of the infections that never been seen in any particular geographical area before, and then you detect it for the first time, then it become the newly emerging infections. So out of this 1415, we can see that more than 800 of these microbial pathogens, about 61% of them are considered zoonotic. Means that the transmission are from animal to human. So you can see here the word zoonotic, infectious disease, is extremely important because it comprises of the majority of the microbial pathogens that infect human. So therefore we can see here that 70%, about 70% of the newly emerging, just what I told you in the slide, is 61% from all the infectious diseases that infect human. But among the newly emerging infections, which I will show you the slide, there are a lot of newly infections within 20 years or 2 decades. Out of that is 70% zoonotic. So it means that it is the animal origin. As you know, the word zoonosis zoon is animal and noson is disease. So it is naturally transmitted from animal to humans, vertebrate animal to humans, but it can have the invertebrate vector in transmitting between the vertebrate animals to humans. So the reason for this infectious zoonotic disease and emerging infections, more than 70% from animal to human, is because of the close human-animal interface. As you know that now we live with the pets, with the animals that is economic animal, so we use it for food, okay, and for many purposes. And as you can see here that as we compare about the rise in the population, now in our world we have about 7.6, 7.7 million populations. But if you look at the increase in the poultry population, the red color, you'll see that poultry is exponentially and then also although it's not as poultry, livestock that also on increase because of the human population is increasing. So by 2030 or 2050 we should have about 9.3 billion people living it. So the needs proteins would be also arise. So therefore you will have a lot of livestock, poultry and other sources of protein will be needed. And as you can see here, since 1976 we have so many diseases has been emerged, whether Ebola, HIV, E. coli, whether it's Hendra virus so it can be through bats, through primates, okay, through palm civets like in SARS coronavirus in 2003, the new influenza H1N1, and then also the avian influenza H5N1, okay, H7N9. There's several emerging infections that are from animal to human. So this is going to be extremely important. As you can see here, usually the microbial pathogens are quite specific to its host. For example, the virus that infect bats, chimpanzee, monkeys, rodents, or bacterial infections or parasitic infections, they are specific to its host. But later on, when the human population grows, we are encroaching on the wildlife, okay, and then also that is a vicinity of the domestic animal to the wildlife, and that is a process we call spillover of the microbial pathogens from animal to human, to before human is to the domestic animals. We call the intermediate host, and after that from the intermediate host it to humans, and then human amplified, and then it spill back to other humans, or maybe back to the animal. So therefore we can see here that these things that we have to understand about the ecosystem, about the human health, environment, and then the animal health. So it's truly linked, and therefore these issues is, in order to understand it nicely, we have to understand also about the animal health. So the surveillance system must also be established in order to understand about the epidemiology, okay, of these pathogens in animals, and how it going to be affecting the domestic animal, and ultimately how it's going to affect human at large as the big pandemic in the future. So therefore, if we could detect early, we could also reduce, okay, by knowing about the first case, laboratory, and how we're going to respond it. We're going to discuss this a little bit later on. So therefore, I'm just trying to tell you that there are so many newly diseases. Okay, we have not put COVID in this map, but you can see here after COVID, you may have other emerging diseases that is definitely going to come. A majority, there are many which are viral diseases, many also bacterial, many also rickettsial, many also the phenomenon, as you can see here, the drug resistant issues. Some is already emerged, widespread, as you can see here, chikungunya, dengue, okay, and also Zika, okay, and other diseases that you may not be acquainted with it, but here it is spreading over the world. Some are in certain geographical areas, some are more than one countries, some are more than one continent, then the pandemic. So therefore, in the past, in fact, in the past, we have been dealing with this emergence of infectious disease since Spanish flu. We have more than 50 million deaths in 1918, and they have estimated that maybe 1/3 or 1/4 That time maybe we have about 2 billion people in 1918, 2 point something billion. So we think that is about 500 million might have been infected and maybe 50 million died. And after that, there is a regularly a series of pandemic or outbreak, okay, occurring with different kind of viruses, whether it's Hong Kong flu, whether Asian flu, and also Ebola, HIV, and also Nipah virus in Malaysia. And then we have MERS and SARS, okay, the swine flu, H1N1, S7N9, and others. And until today, we have many viral diseases that are spreading around the world. Okay, as you can see here, even yellow fever has been detected, okay, in the new geographical area, and West Nile virus also in USA, dengue in Miami, okay, and also we have Zika in South America. So therefore, when we saying something about One Health, what we mean here is that it is the concept of interdisciplinary collaborations of human health, animal health, and environment or ecosystem. So therefore, we cannot see it as a separate entity. We are looking as a whole, okay, that how if we are going to protect the human health well, we also have to understand the animal health. So it is truly interconnected, and also these two aspects of health also interconnected fully with the environment ecosystem, because how the disease spread in the environment, many vectors are living in the environment, so how those are going to be interfaced also with the human and animal, and what are the ecological factors, whether it is temperature, weather, climate, biodiversity, water, okay, everything is interconnected. For this is what we call as One Health. And as you know that if you look at this picture, you will see that human, animal, they are interfacing in the real life. You have a domestic animal also in its closeness with the wildlife. So wildlife pathogens is among the wildlife in the past, but now those pathogens are going to be easily spill over to the domestic animals, and ultimately is going to be to the human populations. So this is something that we have to see. And as you can see here, One Health approach, it means that we have to work together. Okay, we have to look in as a whole, not as a piece by piece. You have to integrate into each other. So all the disciplines in the side of the animal health, human health, environment have to look into each other, and then you have to come up with the approach that is going to solve the problem, solve the issues. So we have the specific discipline, not only specific discipline, but we have to using those specific discipline, and then having approach that would make sense, and also create some approach that is going to be useful. I will give you some of those examples later on. So therefore, we have a word, several ideas that, as you can see here, somebody say multidisciplinary research. So it means that you have a discipline, different discipline are sitting together, but still they are holding on that discipline. But you are writing the same idea, the ideas that are together, but it's not blended. Okay, it's not totally blended together. So therefore, it's still, you still hold onto your discipline. These are some of the the word that we use when we say multidisciplinary, then we see that we still use our discipline to lead us. So the one more level of more integrations among disciplines would be interdisciplinary research. Okay, so it means that you have a different discipline coming together and then you create another new area of interdisciplinary. For example, in medicine, as you can see here, that oncology, cancer, and then with the nuclear medicine, okay, nuclear physics, so it's a radiation, so it becomes the oncology and radiation together, so it becomes a new discipline. Okay, so public health and computer science, okay, become the public health informatics, okay, how to manage and how to use the data science together in order to maximize the informations on information. So it become public health and informatics. So it can be blended. So these kind of issue things we call interdisciplinary. But transdisciplinary, we are not holding to our discipline anymore. We are using the problems. We are taking the problems or issues as our main issues. So for example, we have flooding, we have climate change, we have COVID issues, which is not going to be any one discipline. So together, and then we forget our discipline, and then we are using our discipline and other disciplines and other group of people, okay, to work together in order to solve the issue, solve the problem. For example, when you say climate, global warming, is not going to be any discipline. If you say rabies problem, is not going to be because it affects human, it affects the animals, it also affects it is linked to the environment also, and then all the discipline, because the media information system also need to be involved in order to solve the issue of rabies. So this is become transdisciplinary.